from Kabul, Afghanistan, as a guest speaker for today. Dr. Walid Hussian has completed his graduation from Medical University in 2015, followed by an immense interest towards mental health. He was motivated to pursue his specialization in psychiatry till 2020. During his 4 years of specialization, he has made a huge contribution towards creating an awareness towards mental health and decreasing the stigma associated with mental health through various platforms like television, magazines, and radio. Today, he will shed some light on the mental health issues and the associated stigma in Afghanistan. Before we proceed towards the presentation, I would just like to shed some insight about what exactly stigma is. So, when we say stigma, it clearly means when somebody is viewing someone in a negative way because of a distinguishable characteristic or a personality trait which is acting like a disadvantage for them in the society. Stigma can lead to discrimination. It can be an obvious discrimination like passing negative comments or remarks towards mental health conditions, or a direct discrimination like isolating somebody who is suffering from a mental health condition. And also, there are some harmful effects of stigma, like a person might not be willing to speak up to a mental health profession. There might be a lot of misunderstandings with the family, friends about mental health conditions. There might be some violence, physical abuse towards the person who is suffering from mental health conditions, and many more factors associated with stigma. Before we begin, I would just like to express my gratitude towards the team of Psychologs Magazine and Dr. Arvind Ota for providing us with this beautiful platform to be a part of this event. I would like to welcome you, Doctor, on behalf of the entire Psychologs Magazine team. Over to you, Doctor.
Thank you, madam. I would like to thank you all that you gave me opportunity to be able to talk about the mental health problems of Afghanistan to the world. So I would present and talk a few minutes about problems of mental health in Afghanistan and associated stigma problems. First of all, namaste, salam alaikum, and good afternoon to everyone and to all of those who are watching us. Thank you. Mental health illness is just like a physical illness of the brain that cause disturbance in thinking, behavior problems, emotional problems, and thinking problems. Research shows that according to a survey and research that 70% of the Afghanistan population are suffering from mental health problem. That's a huge number. And this problem can be depression, schizophrenia, unfortunately, substance addiction like cocaine, marijuana, cannabis. They are on rise, unfortunately, from last a few years. Despite international efforts that they are trying to decrease the substance use in Afghanistan, but unfortunately, it shows a huge number. Afghanistan has different kind of problems, whether it is armed conflict, poverty, social problems, economic problems, and this pandemic adds problem more to the world, especially to the poor country, underdeveloped country. We suffer a lot from this pandemic. So domestic violence has rise during this pandemic, unfortunately. With this economic problem, we are also suffering. Every day we are witnessing the sounds, not with the sound of clock, unfortunately. This is a very big problem for us. From last 4 decades, we are facing this conflict. We've grown up in war, and unfortunately, we will die one day in war. So we haven't seen a very good life, especially in Afghanistan. So last year, uh, from 1 year, Kabul situation is like a horror movies. We are daily facing blast, and we end up a day with the blast. When we go out, we don't expect that we will come back alive. So every day we say goodbye to our families. It's just like a goodbye that we are saying. Unfortunately, the health sector is not capable of providing a very good health system to the population of Afghanistan. We don't have a very uh, professional uh, professional health cares, like professional mental health cares, like social workers, clinical psychologists, or mental health nurses. We have around 150 psychiatrists in Afghanistan. To the whole nation, 150 psychiatrists are not sufficient. So, from one hand, we have a stigma problem in Afghanistan. The most important cause of stigma in Afghanistan is awareness problem. We don't have good publicity to the people to make them aware that the brain can also get sick just like other organs of the body. So they are not fully aware, and also they have been stigmatized very badly because when a person is suffering from schizophrenia, when this schizophrenia go out of the home, so they are bullied by the uh, school classmates, or by even by the school teachers, or at the streets or outside the home. They are also being called by different bad names. So when a girl gets a mental health problem, no one is ready to get married with that girl. She's been called mad, or uh, she's by different bad names. So this is a very bad effect on mental health system. So they don't come to the psychiatrist at first. They go to the shrines. They get different kind of uh, religious person. They go to the religious person. They don't come to the psychiatrist first. So when their sickness gets very chronic to the psychiatrist, they go to other physician, general physician, or general surgeons for their problems. So when they come to us, they are at the end stage of their uh, as mental health problems. So it is a challenge for us to heal them or to give them medication, because they come to us after 4 or 5 years. This is very late. So we are still trying our best to face the society challenges and make the people aware. Personally, I go from very different kind of media for TV shows, morning shows, to make aware people about their mental health problems. I go to the radios to make them aware. And even in these bad situations, I used to follow some of my patients at their homes. I know this is a very dangerous work for me as a doctor, as a psychiatrist, to go to the different parts of the capital. Is very unsafe. So I still go to their homes, um, make them aware, their family, ask for family supports, for social supports. I'm doing my best to make the people aware and de-stigmatize the patient So this is what I can do for the patients. Also in Afghanistan, uh, we are facing child marriages. Child marriages is one of the biggest challenges we are facing this culture problem. Girls get married at the age of 12 and 13, and putting a very huge responsibilities on their shoulders, and a weak shoulders, I must say. Uh, the 12 and 13 years old girl cannot bear all this burden. Marriage is a very big burden on for a child. So they suffers a lot from mental health problems. In this 12 and 13 or year old girl have to take care of 7 up to 10 family members, which is not easy job. So this is a big problem for us. I'm talking to their parents. I'm going to the TV channels to make the people aware that child marriages is not allowed in any religion. So when they get pregnant, after pregnancy, they suffers a lot from postpartum depression and postpartum psychosis. They are very vulnerable to the this diseases. Also, COVID pandemic affect the whole world economically, socially, and mentally. So, as a poor nation, we suffered a lot. This COVID uh, adds more problem to our economically, socially, and mentally. When a person gets jobless, so definitely economic plays a very important role in the family. And when a man cannot support his family, so definitely he will uh, uh, fight with his wife. So domestic violence will rise, and this will affect indirectly the children's. Children cannot forget when his or her mother is being beaten in front of her eyes, and also uh, this is a big challenge that our government could not fulfill all these challenges, especially these economic problems. So uh, Kabul, I mentioned earlier that this is just like a horror movie. Every day we are facing uh, blast, and this blast has a very negative effect on the children, like PTSD. PTSD is something that children cannot forget it for the whole life if not treated very well. So, as a psychiatrist, I'm trying to do psychotherapies with my patients, and also pharmacotherapies uh, that decrease the sign and symptom of the patient, like nightmares, one of the biggest problems for the PTSD patients. So I'm trying my best to uh, cure and treat my patients as much as I can, because we are, as I mentioned, lacking psychiatrists in Afghanistan, especially in Kabul. I'm not talking about the provinces of Afghanistan. We are having problem in Kabul, which is the capital of Afghanistan. So we have more problems in a rural area like uh, Kandahar, Helmand, Zabul. We are having more problems in this kind. And these provinces. So because economic is also status of compel the children to go and work as a child labor, and working as a child labor. Definitely they will suffer from sexual abuse there, physical abuse, and this physical and sexual abuse will change their personality, change their personality to the antisocial personality. So this is a problems of Afghanistan. So I hope that this peace process, which is going uh, in Afghanistan, this will give a good result and positive result and make us feel at least we are like other nations of the world. Take a deep breath and feel we are safe now and we are living as a human being like other nations of the world. So uh, hope this was interesting. I want to talk more, but I don't know about the time, so I will uh, end up my first portion. And thank you, madam.
Sir, you spoke about postpartum psychosis, that when a child, when a girl, and gets child married, when she gets married very early, so there are high chances that she will suffer from postpartum psychosis. Could you explain a little detail about what exactly this diagnosis or disorder is about? What are the likely symptoms? Are likely to be seen, and is it only a child can have it, or it's applicable to adults also?
Madam, postpartum psychosis, whenever I go to the National Hospital of Mental Health in Kabul, so when I see different ages are coming to the hospital for admissions, so it can be children like 2 12 years, they get pregnant, they come to the hospital, diagnosed as a postpartum. So different ages can be affected by the postpartum depression and psychosis, but mostly in Kabul, I have seen that the teenagers coming to the hospital as a postpartum psychosis and depression. So mostly I have seen this problem in child marriages, which is about 12, 13 or 14-year girls. When they get pregnant, after delivery, they come to the hospital and diagnosed as a postpartum psychosis.
And is it only curable with medications, or it can be done with counseling also? What is the treatment for this?
First of all, we are starting antipsychotics for the postpartum psychosis, safe antipsychotics which will not harm the baby and also the health of the breast feeding mothers. So we are choosing safe antipsychotics. Also, we have a few psychologists. They are not clinical psychologists, but they have seen some trainings, some uh, foreign psychologists has came to Afghanistan to train them. So they are working with the patients psychologically and pharmacologically. We are helping the patients. Also, we have a few social workers. So as a teamwork, We are trying to help the patient to overcome. Also, we are asking for the family support of the uh, patient. Family support is very important. In Afghanistan, we are lacking family support, also social support, which is very important for the patient. And whenever a patient gets a mental health problem, so everyone is thinking that this is not a medical problem. We should take this patient to the shrines or to other religious person to help out the patient. So it's a biggest challenge for us.
Definitely, I can understand that. So the symptoms are basically the girl, like the patient gets into depression, and any other symptoms for this disorder?
You're talking about the symptoms postpartum depression.
Postpartum psychosis.
So
Yeah, yeah.
okay, okay. The patient developed delusions about her health or about the baby. Most of time they have a delusion. Delusion is a false fixed belief. So they develop some delusions about the baby. They are saying that this is not my baby, or I have lost my baby. So most of their delusion is to the towards baby. Also, they have other delusions, but the main delusion is towards the baby. They are saying that mine was boy, so it's changed by the girl. So most of time their delusions are being about the baby or about their health or about delusion about the husband or other member of the family.
Okay. So we have one question from the audience. His name is Manish. So Manish asks, Dear Sir, what is the statistics of mental health professions outside Kabul, outside Kabul in Afghanistan?
Unfortunately, very less, very less. I must say that we have only one psychiatrist and per province. We also have 34 provinces in Afghanistan. So it is every province is as big as Delhi or Mumbai. So we have only one psychiatrist or maybe two, three psychiatrists in big provinces. So they cannot fulfill the whole requirement of the provinces. So therefore, I'm asking that we are lacking mental health professionals. Also, we have a stigma in doctors. Most of the doctors are not ready to get their specialization in mental health field because they feel if I get my specialization in mental health field, so I may get mad or I may get mental health problems at the end. So this is a very big challenge as well for doctors. They have a stigma. They are not ready to go to the um, mental health field. They think that if I study or work in a mental health hospital, I may get mad at the end of my career. So this is a problem for us.
Right. We have one more question from Tanisha from audience. She says, Doctor, as you mentioned, condition of Afghanistan is not good due to bomb blasts and various other reasons. So mental health, is it because that mental health professions are leaving Afghanistan after training? Could that be one of the reasons?
Unfortunately, from 2015 up to now, most of the doctors left the country. Yes, this is a problem. Most of the doctors has have been kidnapped, uh, or they also left the country. They fled from Afghanistan. Yes, doctors are leaving Afghanistan. So this is my commitment that I will not leave. Honestly, yes, I went to the India in 2018. I did my fellowship in Fortis hospitals, but I came back to Afghanistan is want to serve my country.
So we have one more question from Sneha. She's asking, in Afghanistan, which is most popular? Is it medication in the field of mental health or psychotherapy?
We are lacking clinical psychologists, so we are mostly focused on medication. First of all, we are giving medication to the patient to make them uh, feel better. So, if needed, I can myself do CBT, cognitive behavior therapy, with some of the patients if they are ready. But uh, most of the patients also they are not have fully awareness about the psychotherapies. So they are saying that doctor just gave me medication, so I'm not very interested that you talk with me. So give me medication, so I will take the medication. Not interested in the psychotherapies or the way you talk with me. It's okay. I am good with the medication.
Yeah. So, doctor, you can carry on with the remaining of your presentation. We have time, like we have another 30 minutes or so, and then if we have more questions, we can take it up that time. So we can carry on.
Okay.
Yeah.
Okay. Okay, madam. So S- uh, I was talking about the war in Afghanistan. We are facing a war from last 4 decades, and we are grown up in war, and especially the children's when they see losing their peers in war or in blast or losing their close family members in war, it has a very bad effect on their mental health. Uh, when a children see that their school has been exploded by the bomb, when they cannot go to school, uh, their school has been destroyed. So it has a very bad effect on the children. So if a child is traumatized or uh, facing trauma, so they are definitely PTSD patients. When they have not been treated with the medication or psychotherapies, so they will face personality changes like antisocial personalities. So this is all the product of the war. So they definitely will even come back to the as a young person. The to They are dangerous for the societies. So from this here now we have to take care of our children when they traumatize or when they are sexually abused, because in a poor society most of the time children have been sexually abused. So sexually abused, PTSD, all will change the personality of the children, which is very dangerous for the society, because the children are the future of a society. When they are personality changed, so the whole uh, uh, society will change. So I'm focusing more on the children's nowadays. That if we make the children's feel comfortable, feel good about their mental health, we can change the coming generation of Afghanistan. We cannot change the personality of a 40 or 50 years old person. So we have to start from a children and make a generation. Uh, yes, madam.
Yeah. Apologies for interrupting you, doctor. But
Yes.
actually, there is one session already scheduled in another 5 minutes, so we'll have to wind up
Okay.
this session now. Really,
Okay.
apologies for that. So yeah, so thank you so much for giving us this valuable insights about the mental health condition in Afghanistan. And definitely, our best wishes and prayers are with you all, and we really hope that soon there is a new light that everybody in Kabul sees it, and we really hope that there are more mental health professions, and the stigma is decreased as soon as possible, because there's a huge need towards mental health. And in fact, I would say in many places within India, right? So we all wish for that day to come soon, that the day the stigma is decreased and everybody is working towards the treatment and willingly taking the treatment and the help required for their mental condition. Yeah. So thank you so much. And I would really like to thank Dr. Arvind Ota for providing us this enlightening experience to be a part of this event. And I would like to thank the Psychologs Magazine for their sincere effort and hard work to make this event a success. And thank you, Doctor. I wish you a great day today. Thank you.
Thank you all. Thank you, psychologs. Thank you, everyone.